My name is Claudette Holloway, a black woman, a registered nurse, and a proud member of RNAO, and the 4th black president of this organization. So long before it became fashionable to talk about these things, RNAO was on the case. There are many stories that we will hear. Many of them can be emotionally uncomfortable. So please be prepared for that, and let's give each other the support that is needed wherever you are sitting. Unfortunately, 15 minutes of our time has already gone, so we're left now with 30 minutes. So we're going to have the panel share their experiences, and as we heard, you'll have a chance to ask questions, and then hopefully we can go back to have them give us one more point. And we know that the issues, you know, we could spend a whole week and we still wouldn't have covered some of the injustices, some of the pain that we've experienced. So before I go any further, I do want to give a shout out to Catriona, my past colleague from Public Health. Welcome and thank you for being here. And we work together with the college, we work together with all the political parties. And the focus of today was to get them to understand equity, yes? Diversity and inclusivity. So again, some of them have the story, some of them still need to hear more. So let's be patient with them. Let's realize that things won't change in a day. This stuff has been going on for hundreds of years, but I'm glad that RNAO and us as members are seeking to do something about it. And we already started, but we know there's a long road to go. So thank you, panel, for sharing those stories that you're going to tell us. I'm going to move it on to who would like to start first. You know what? Sometimes I like to go with how the spirit moves, because pointing out someone is not always the way to go. Yes? So, you know, we'll let them start and let's see how it goes, because this topic is not easy. Thank you.
Sure.
We have mics here.
Anything fancy I gotta do? Is this working? No. Try another one. Is there a switch? I need a stage manager! Can we get a big one? See? I'm an actor. I need a stage manager. Beautiful. Now do you hear me? No. Still don't hear me. It's muted there. See, you got the face. I promise you I give you the face. Which switch? Oh, now we're good. Now we can all hear me. Hi. Welcome. Do you want to ask me anything or you just want me to talk? I'm going to talk. But please cut me off when you need to cut me off, because I love to talk.
Don't worry, I will.
Good. I love this. So hi, my name is John Edwards. I'm a gay man. I am a nurse. I've been a nurse for about 6 years. The reason I'm here, and I love that we were sort of introduced with the sort of idea with equity, diversity, and inclusion, and sort of our stories of pain and difficulty. And the reason that I am here is actually a little bit of the opposite of that. Because when I started my master's research, I was really interested in what was the influence community has on gay and HIV positive men. As a man of a certain age, HIV is in my bones. It is in every experience, every story, every movie, every television show that I saw from like the 80s through the 90s. And so that's what I thought being gay was going to be. It's also what my mom, who was a nurse, thought being gay was going to be. And when I came out to her, she wept because she really thought I was going to die. And in fact, you know, history as a dancer, I went through a period of time where I didn't eat very well in college, and I got very thin and came home for Christmas, and Mom went, oh my God. In fact, I was just hungry. And I did all fine. So when I started my master's research looking at communities, and you're always looking into your background research to be like, what are we talking about when we talk about community? And what I found when talking about the queer community, that is the term that I use for 2S LGBTQ, because there's a lot of letters. So I talk about queer when I talk about all of us as an umbrella. And what I found in the research on the queer community is it's all negative. I think as healthcare professionals, while we're trying to address issues, and I think this actually extends to all of our communities, we are focusing on the things that are going wrong because we want to improve them. But in research, what is spoken about, what is written down, becomes the truth. And so if we only speak about the things that are not great in our communities, which in my case was all about mental illness, substance use, lots of HIV, promiscuous sex, drug use, like so many of these things, that's all we were talking about. And as a result, people and the powers that exist above us begin to think that gay men in particular are only mental illness, substance use, and HIV. And this is not true. So that was very upsetting as a researcher and as a person who's a part of the queer community, to think, is this what everybody thinks about me? When I walk into the hospital, is this how all healthcare professionals view me? And in fact, it isn't. And this is part of why I live the way I do, which is to be not necessarily political, but I am loud. I am a performer. I have been in the spotlight for my whole adult life. I'm used to speaking to thousands of people in order to sway an idea. And so I really wanted to sort of share positive stories. So that's what my research became, looking at an organization, the People with AIDS Foundation, and the experiences within that organization that were positive, and how community and being a part of that community helped people. And it, in fact, turned out to improve their mental health, reduce substance use. Yes, HIV is there, but it's wildly stigmatized still, despite all of the incredible advances that we have made in HIV. It is wildly stigmatized. But being a part of a community is a positive thing. It does good things, and I was able to share stories. That was the whole crux of my research, was to gather people's stories. To be like, tell me about what it is like for you to be a gay man in this group. What is it like for you to be HIV positive in this group? And they told me all these incredible stories about the supportiveness, the getting on a bike and going 600 kilometers from Toronto to Montreal, and how rewarding that is, and the fact that it doesn't matter how they're shaped, how old they are, whether they're positive or not. They were able to do it, and they were able to make friends that they didn't have access to necessarily in the broader queer community. And so, when I sort of had this idea, I did my research, it went successfully, and that was great. But then I came back to the RNAO group, the Rainbow Nursing Interest Group, and I thought, the world is not good right now. We can all agree on that, yes? There's a lot of awful things happening in the world. And I thought, you know what? Maybe right now is not the time to discuss our moments of suffering and pain and the sort of trials and tribulations we've gone through. Those things are real. They have happened. They are important. We do need to fix them. But let's talk about some of the stuff that's good. Some of the things that make us successful and vibrant and wonderful within the healthcare system and just in general. So I reached out to my executive and I reached out to our members to say, tell me about you. Tell me about the good things that happen in the healthcare system. Tell me about the good things that you've experienced as a nurse. And we're working on that. That is still a work in progress. I think perhaps in this particular climate we're experiencing, there's a bit of fear, there's a bit of trepidation in sharing personal stories about their loved ones, their just sort of general experience, because it can be dangerous to sort of stick your neck out. And I do find, I was actually saying this in the lunch line earlier, that nurses can be nervous to stick their neck out. And so what I would say, because my story essentially is, we know now that I'm a performer, I did that for 15 years, I'm used to being loud and sticking my neck out. That didn't change when I decided I was going to become a nurse. And as a result, I'm a bit of an oddball. I am this sort of obvious gay man. I'm not shy about that. I tell my patients when they ask about, oh, tell me about your wife. And I'm like, well, Jameson, my boyfriend, and my cat, and we went to Mexico, and I'm just very, here it is. And they can take it or leave it. And I do respect that I am in this body. I am this height. I have this color of skin. There is a way that I am perceived out in the world that maybe not everybody else is, and it gives me a great deal of privilege. So that is partly why I am as obvious and open about my personal life in all avenues, because I create a living example that fights a stereotype. When I'm standing in front of a classroom and I tell people about my Jameson and my cat and my trip to Mexico, and I put those pictures up on the screen for everybody to see, thank you, I told you I need someone to cut me off. That creates space. One, it says exactly, this is who I am, right at the front of the audience, for the classroom, for all of my students, for all of my patients. And it creates room for everybody else in the room, if they feel different or odd in some way, to empathize with me. And it creates space for them to be exactly who they are. I'm telling them, you can be this. Be this with me. I want you to be yourself all the time. I want my patients to be themselves all the time. And the more we can humanize what we do, because I think this is the sort of the grand thing that all nurses are capable of. We're the great translators of everything in healthcare, right? All of our physicians and all of the different sort of health disciplines have all these different languages that come at the patient. And then we come in and go, did you get any of that? Do you need me to sort of translate into human language? Because we are all humans and we can all get behind stories. It's really easy to connect on a base level when we just tell each other the stories about our lives. It doesn't matter whose hand we're holding, what genitalia we may or may not have, what pronouns we use, what color our skin is. None of that actually matters in the grand scheme of things. We are people. And we want to just tell stories to each other because we can connect on that. So I encourage you, if you feel you are an ally, if you feel you want to help, if you don't know how to understand somebody else's story, just talk about your life. You can empathize with anyone else's story, regardless of who you are or where you come from, because we can all connect on very basic, simple things. Thank you.
Thank you for helping us to focus on the positives. Yes, thank you.
Hi there. Can you hear me? Yeah. So I'm gonna stand at the podium. Hold on here. I have a tendency to waver. So I'm Lori Zazzolato. I am a Black nurse, and I am the chair of Black Nurses Leading Change, which is an honor. And I told them that if I was going to be chair, that my mandate was that while we've gone through a lot of trauma, that was not going to be our basis, that we are in the midst of the greatest Black Renaissance that our people have gone through since we were released from slavery, and I want to build on that. I want to keep moving forward. That being said, I think it would be helpful for you guys to kind of know the weight that Black nurses everywhere carry. Racism has been a thread in the tapestry of my life and Black nurses and Black people's lives forever. That thread sometimes is very large, sometimes gets really, really thin, but it's always in the tapestry of my life. And sometimes, like I said, it's bigger and I'll go, oh, there it is. And then when I think it's almost gone, it kind of rears its ugly head. I mean, it began when I was 6 years old and we moved to a predominantly white neighborhood, and I was surrounded by 250 Black kids in the schoolyard, and that was the first time I ever had the N-word called. So that was kind of very distressing. And then that tapestry continued on again through school, and then when I decided to become a nurse. I remember it reared its head there again when, excuse me, my instructor at school was telling us all, keep your marks up high. This was in college. Keep your marks up high as an RPN, because that will determine, where you go, what kind of placement you get. So she said, we keep 2 positions just for RPNs who are going to the ER. And I thought, wow, maybe I could get one of those. So I'm the first person in my family to literally break out of the ghetto. So I had, there was no, when you go to college, when you go to school, there was no history of that. I actually didn't know what to do. So I thought, I'll ask my instructor. I said, what do I do to get one of those 2 spots so I get that edge, so I get a good start out of nursing school? And she stepped back, looked me up and down and said, don't even bother. You're not going to get it. So of course, me being me, I was very determined. I got one of the positions and I became the class valedictorian. And again, this is just, part of, that whole thread of racism and the tapestry of my life. My sister and I have an older sister, so as teenagers, we decided we're having all these racist experiences. And we thought, it can make us bitter or it can make us better. So we decided that for our lives, we were going to be ambassadors. We were never going to live up to the stereotype. We were not going to turn the other cheek. We were going to stand up for ourselves, but we were going to be the best people that we could be no matter what we faced. So I became an RPN, then I became an RN, and unfortunately, these experiences still happen. I remember going to see a patient, and I called him into the office and said, Mr. Joe Smith, come in. He looked up from his newspaper, looked back down and said, oh, I'm not seeing you, I'm RN only. And I said, you can tell I'm not an RN by looking at me? And I said, I'm an RN. And without skipping a beat, he said, are you diploma or degree? So I said to him at the time, I said, I graduated from McMaster. And I said, I graduated from the #1 school in Canada, #4 in the world. Do you think I can change your bandage? So to which he kind of, oh, okay. So I keep having these experiences, but I just keep pushing forward, pushing forward, because that's all you can do. I've also had other patients that will, see me and say, oh, are any of the regular nurses here that I can see? And I'm thinking, you don't even know me. And I just say, no problem. And within, 1 or 2 visits, those people are then asking for me. But as I said, I can't ever be just the nurse or just a person. I'm always the black nurse. And that always carries a little bit of extra weight with you. So, be kind to your nursing students. Whenever I see them, whenever I see ethnic nurses, I always say, I see you, I know what you're going through, it's a little bit hard, but keep going, and it's getting better, it's gotten better, it's gonna keep getting better. So you just keep moving on. And I know there's a lot of talk about intersectionality, and some people will say, oh, those rainbow problems, those indigenous problems, those black problems, they're not mine, so I really can't empathize or sympathize. But at its very basis, the things that are happening to all those 3 groups are bullying on a global scale. So what would happen if we all accepted each other just as who we are and said, hey, show up as your authentic self, be the best person that you can be. I'll help you be the best person that you can be. You help me to be the best person that can be. And if I see something bad happening to you, doesn't matter that you're different or that you're not from my group, I'm gonna stand up and say, hey, that's not nice. So what would happen? What kind of world would we create if we were all just kind to each other? And we all allowed each other to be our most authentic selves. Imagine if you could go to work every day and not worry about, what do I look like? What are they gonna think about me? What group do I belong to? What are they gonna, and you could just show up and say, hey, I'm here, I'm gonna be my best. I mean, think of all the mental health issues that would go away. So we are pushing forward. We are doing amazing things, especially with black nurses leading change. We are, if you're an RN, we're encouraging you to be an RPN. If you're an RPN, we're encouraging you to be an RN. If you're an RN, we're saying, hey, get your master's, you got your master's. We want you to become a doctor. And we're just telling everybody, keep going, because we're doing great things, but we've come from behind. Because you have to think that when your great-grandparents started out, they bought a house, then they had, your grandparents, then they had your parents. My great-grandfather was in a field picking cotton, literally. So we are 200 years behind what the other ethnicities in the world are. But we're catching up. We just need a chance, and we need understanding, and we need sympathy. And again, we're just asking for everyone to be kind to each other. So that's what I have to say.
Thank you. It's all about respect. It's all about respect and valuing each other as human beings.
I guess I'm last. Is this on? Okay. That was really loud. I'm so sorry. My name is Victoria, and I'm the chair of the Indigenous Nurses and Allies Interest Group. I'm a little bit nervous, so I apologize. I come kind of with a different perspective. I have the last name Guido, which is very Italian, but my mother is First Nations, so I don't share the same experience that majority of Indigenous nurses share, but I'm here to just kind of inform you that every Indigenous nurse is different. We're all at a different stage in our journey, just like how everybody here is at a different stage in their learning journey. And that, yeah, let me think. Sorry. I'm losing my train of thought.
You're all right.
That this group that we formed, Rachel Raddick had formed it back in 2020 through a kind of difficult period during COVID where not everybody was really into wanting to do extracurriculars. So we're still kind of figuring ourselves out, but we are a strong group of Indigenous and allies, nursing students and RNs, and we just want to make sure that everybody knows that we are in the room and that we do have a voice and that we do deserve to be heard. We deserve to have that seat at the table when it is necessary for us, which is always. We need to be there to make the decisions in healthcare, in politics, in every single aspect of life, because Indigenous people were, as everybody knows, the first people on the land, so we deserve the seats that we don't always get. Along with like everybody else on this panel. It's just important to realize that even though we do have a small amount of education about Indigenous people in our school system, it's not enough. I personally went to McMaster University, which is very close to Six Nations. And I went to school with many people from the area who didn't know that there was a reservation even in Brantford or in Southern Ontario. Which is a little bit shocking to me, seeing as it's just around the corner. And that was only 4 years ago. So there's still a lot of learning that needs to be done. And I congratulate all of you because I know most of you here have been doing that work, which is important. But we have to like keep doing more work because the voice of Indigenous people need to be heard, especially like in healthcare. Yeah, I think really my main point is, although Indigenous people might not look the way that you would assume an Indigenous person would look, we all have our own unique perspectives on how colonialism and systemic racism affect us today. Even though some of us might be First Nations, Métis, Inuit, status, non-status, all of our opinions still matter and we're still deserving of everything that everybody else is. I think that's probably everything I have to say. Thank you. Okay, never mind. I'm back. If everybody sees my nice outfit, I do have a ribbon skirt on today, which, as many of you probably in the room, just wear scrubs all the time. So when I can, I like to bring out my ribbon skirts. This one was personally made by a girl named Raven. I think she used to be in Kitchener, but now she's out, I believe, in Manitoba. But this is something that my sister has been learning to make because as our family didn't really grow up knowing where we came from or knowing our Indigenous roots, so my sisters and I have been dedicating most of our adult life to just regaining that strength and regaining all of the knowledge that we unfortunately didn't get to know. So yeah, this is a ribbon skirt if anybody wants to see. And on that topic, if you can, I would encourage everybody in the summer on June 21st to go to Fort York and go to the powwow. It's a great place to just start your education, just to be immersed in a beautiful culture, to see just amazing community, also eat really good food, and you can see all of our artwork, see the work that these people get to do, and you can support them by buying it. And then you get to wear nice pretty earrings to things like this, so thank you.
Thank you. I'm learning more about the ribbon skirts. Our board member Maxine has taught me a lot about them, and I'm learning a lot. Your executive, RNAO's executive, Doris Lamo, and I had the privilege of being invited to a celebration late last year where we had it was the freezing moon celebration. And it was, the community organizations that got together. So learning more and more about Indigenous culture is really, really important. I want to say, John, that I am very familiar with the LGBTQ from decades ago, because one of the most significant people for me when I was training in England, yes, we went through training and education, 3 years of it, was a member of the gay community. And so long before this thing became fashionable. So I'm glad to say that I'm willing to engage with people. I am prepared to offer respect to people. And I'm also prepared to learn. And I hope all of us are willing to learn and move forward. So you have a chance now. I would take 3 questions. If anyone wants to come forward, we can use one of these mics here. I'll bring the mic to you. Thank you.
Thank you very much, Victoria. I want to mention for Northern Ontario. I am from Northern Ontario. I'm wearing orange. And our motto is every child matters. And we don't have health care in the North. It is very, very scarce, and in fact leaving. And I want to thank you for coming, and I recognize your skirt and the tinkle dress and all the other things. But we have to, as nurses, recognize the need for Indigenous health care, the Métis, and all of, because I actually led the Truth and Reconciliation recommendation for the RNAO 8 years ago. There were only Métis and Indigenous people on, and I heard the stories. And we all read the Truth and Reconciliation recommendations from Honorable Murray Sinclair. And we're still working at it. But I want you to stand, because Maxine's name was mentioned, and she's at the Garden River Reserve, and she's a nurse practitioner. And this weekend, because what they're doing all through the Northern Ontario is restoring the dignity that was removed. And that's what we have, that's a positive. And this weekend, they have invited all of the reservation, all of the public, everybody, to come and learn the gardening. Back to the, and they have the elders and everybody there. It's been publicized through CBC, and it's wonderful because what we're doing up there is trying to restore, but we need health care and we need social services. Thanks.
I only have a very quick question. Thank you for your comments, and I just want you to know that the RNAO is also working big time on it with Indigenous communities, all of the 3 First Nations, Inuit and Métis, and we have BPSOs, and we are going, in fact, to Thunder Bay, just so you know, in the fall, and we are staying, and this is to the point that you were trying to make, Victoria, about helping economically communities. We're staying in an Indigenous-owned hotel for a purpose, for a purpose. And whoever wants to stay somewhere else, they can, but we don't give reimbursement, only in the indigenous zone. That's the type of action we need to take. The question is, because you all try to focus on the positive, and I want to build on that, I think this world needs it. What was the happiest moment for you as a gay person, as a black person, as an indigenous person in nursing, if you can? Because we can learn from the positive moments.
Well, they pull their thoughts together. I just want to thank Dot. She has spent a lifetime in service, parish nurse, a lifetime investing in people. Thank you, Dot. Let's give her a round of applause.
In this profession.
60 years.
Before OHIP, I was practicing as a BOM nurse. We did not have OHIP. I am seeing it being lost. We gave service free. And we have to again.
We will fight for publicly funded health care. Thank you. Back to the panel.
On? We're on. Happiest moment in nursing as a gay man. I honestly think, I don't know if there's like one particular moment, but the thing I love the most is when I'm on the floor and you have a moment with someone who is like you. You have sort of this like, I see you and your husband, or I see this is potentially maybe this is someone who's a lesbian, or I've worked with people who are also transgendered. And when you have that little moment where they clock you as the nurse that's going to work with them, you see this sort of relaxation moment happen, where they're just like, I get to be myself. I live for that moment. When there's that little twinkle that says, we see each other. We're going to talk about RuPaul or something. Yeah, that makes me very, very happy, because I can see in that moment they now feel safe in my home. And that's what I want for all of my patients, but especially the queer ones.
I'm going to give you 2 moments really fast. Number one, I don't do bedside nursing anymore. I work as a clinical specialist for a medical supply company. So the greatest joy I've most recently had is the fact that I travel around Ontario and the eastern provinces. And I have just had so much joy in all of the Black and other ethnic nurses that come up to me and say, oh my God, I'm so happy to see you. I never thought I would see someone in your position doing something like you're doing. I'm going to try. So, and becoming chair of the Black Nurses Leading Change has brought me great joy, because I have never been so proud to be Black. I have never been in rooms with such amazing and uplifting people, and I just feel like I can take over the world.
I also have 2. I think my first would be that I was able to graduate as an Indigenous student from my Bachelor's of Science in Nursing. So I got to have my own special ceremony with our school, which I didn't think would ever be something I could do, which was really cool. And I think that I now feel confident enough to stand up and speak up for my patients who are Indigenous. And I now have the courage to correct the doctors when they're wrong and tell them that, you can't just do certain things, and you need to take into account where she's coming from, how old she is, her living situation, because those things matter. It doesn't make her any worse or better of a parent, but we need to think about those things and help and give support. So I'm happy that I now am able to kind of give those answers.
Thank you, panel. Let's stand and give them appreciation. Let's stand, because this is not easy. So thank you, and I believe we now have a video.
Yes.
You want to step down?
You're doing it. Thank you. Thank you, Mitachi.
To promote equity, diversity, and inclusion within the nursing community, RNAO is showcasing the remarkable stories of those who've often been underrepresented. John Edwards, registered nurse and secretary of RNAO's Rainbow Nursing Interest Group, collected stories from colleagues about their achievements and struggles as part of different minority groups in Ontario.
So the initiative of storytelling, what I really wanted was I did my master's research on gay and HIV positive men, and I was looking at the influence community had on their health and well-being. I think especially because of my experience as an educator, as a nurse, I get to work with so many different kinds of people, and I love that. That's the part about being an educator that I really, really get excited about. And I've seen when it can be uncomfortable for people. I've seen when they don't feel like they quite fit in, and this is an opportunity for me in my job to sort of open the door and say, yeah, I'm a little bit odd too, and here I am in this position. So I get to be sort of a living example of things that go well in the community. That pushes back against stereotypes, I think.
RN's Victoria Guido, chair of RNAO's Indigenous Nurses and Allies Interest Group, and Lori Zozolato, chair of RNAO's Black Nurses Leading Change Interest Group, also shared their stories.
I'm mixed Indigenous registered nurse. I'm Anishinaabe and Cree from Northern Ontario, and I'm the daughter of a first-generation Italian immigrant. During my undergraduate degree, it became very apparent how little people knew about the very real, severe, and life-threatening issues Indigenous peoples face every day and have been facing for decades in our healthcare system. It made me very angry seeing how our curriculum lacked education about Indigenous peoples, our traditional practices, and the issues faced by Indigenous peoples in the healthcare system. This lack of education has perpetuated harmful ideologies of racism and discrimination, while also reinforcing the misguided belief that Indigenous knowledge and practices are inferior within the Western healthcare system. This destructive cycle is then passed down to future generations of healthcare professionals, further contributing to the problem.
My lived experience as a Black nurse is my lived-in experience as a Black woman. The two are inseparable. I am never just a nurse. Anti-Black racism has been a thread in the tapestry of my life. As a nurse, this thread of anti-Black racism followed me, beginning in my nursing program in college, where when I expressed an interest in applying to an advanced program, my instructor took a step back, literally looked me up and down, and told me not to bother applying because I would never get it. Speed forward to working as a nurse where my caseload was always heavier than my non-ethnic counterparts. And when I asked about it, being told that it was a tribute to me as a skill for being a nurse.
Those are the kinds of stories I want to pull out. I know nurses encounter different people and in these different environments, and I want to know what's the effect on you when you are a nurse who's working with someone who's part of the community. Does that feel good for you? Often it does. And then how does your patient respond to that? Do they feel good? Often it is a positive response.
At Queen's Park Day, one of RNAO's most important events of the year, John, Victoria, and Lori will share how they're taking bold steps forward in fostering equity, diversity, and inclusion in Ontario's nursing profession and health system.
Panel and to Claudette and Michelle Ray, can you put your hand up? Is Michelle here? Okay. Matt, can you ask Michelle to come for a minute? Thank you. I do want you to connect with Michelle if you have interest on the BPG tackling systemic racism against black nurses. And you do need to you need to identify as black. That goes without saying. So not allies, but actually identify as black. You can be a reviewer. The panel is already well on its way, and they're doing work. But if you want to be a reviewer or in any other way, Michelle, put your hand up, please. Thank you so much. As I said, Michelle is the director of the IABBG program, recently appointed by me, and she's amazing, and connect with her. Okay? Some people may be interested, Michelle, in the BPG. And if you want to know more about the Equity Consortium, let us know. I will connect you either with the consortium or with anything. And if you want to know about other activities that we do, look at the In Focus, RNAO In Focus page. Raul, thank you for that video. Raul also has been discriminated more than once by accent and by accent, I guess. I guess when I went to the US, I must say, it was fascinating. They thought I should come with the feathers or something. They didn't know where Chile was and what was that thing and how do people live there. But I must say that Canada is a bit more educated. It really is, comparatively speaking. Yes, we have long ways to go, but our colleagues in the US tell us that whether it is about 2S LGBTQ+, whether it is about black nurses, whether it is about indigenous nurses, or any community that doesn't look completely white and speaks the English that they speak in that state, not even in another state, they really have a harder time than here. And I can attest to that because I was 6 years there, although my family and I were the lucky ones that had a good time on the work that we did and were respected, but that's not the case always. And maybe it was because I was a bit like Lori and I just went for it. And you know, if you didn't like it, well, tough luck. I'm a good clinician. My language may not be good, but I am. So keep going, Lori, and serve as a model for so many others that we need to serve. Serve as a model, role model for others. We will take a 5-minute break unless the minister is here. The minister is here. Thank you, minister. So we will let the minister come this way. I do want to say our president will introduce the minister, but I want to say a few words about Minister Jones. I still don't see Minister Jones. Oh, here, Minister Jones. I was looking there. The reason I'm going to say, and you can ask the Premier, I said it was a private meeting we had with the Premier, Madam President Claudette Holloway, President-elect Lamo Dolkar, and I had a wonderful time. He gave us way more time than what we thought it would be. I will give you tips because we have some things that we can sign together. I think we are close to. But that's not for this meeting. But I did tell the Premier that I stood next to you when you did the announcement on the 53 community health.
78.
No, momento. I say it as it is. 53 new team-based models and 25 expanded. So that's what it is, right? $110 million, yes, as you heard in the question period, 3 times more than what they committed in the previous budget. And there are many more not announced yet that we hope it will. And then other things that we are cooking that we can talk with you. I also want to thank the minister. I hope she will mention, but the RN prescribing, I told the colleagues that we had been asking for many, many years, and you made it happen. I want to tell you that we have here Natalie Boudreau. I don't know if Natalie left or is here. Natalie works with Karima Belgi, with Dr. Karima Belgi. And also we have here Catriona Mills. I think she's here still or not. Maybe she left. Catriona works at the college, and we work as a team, and you were part of that team that made that RN prescribing happen, and we had the first graduated nurse RNAO member, I need to say that, yes, 2 days ago. So Minister Claudette, you want to introduce formally the minister? I just needed to talk from the heart. Thank you.
Thank you, Doris. And from the heart, thank you, Minister, for all what you're doing for us. And we look forward to working with you going forward to do even more for healthcare and for nursing. The Honourable Sylvia Jones is currently Ontario's Deputy Premier and Minister of Health, where her focus is building a strong healthcare system for all Ontarians. Minister Jones previously served as the Solicitor General from 2019 to 2022, where she championed public safety initiatives, including leading the country with a $307 million anti-human trafficking strategy and legislation, and passing Canada's toughest animal protection legislation. Minister Jones has lived in Dufferin, Caledon for over 30 years with her husband, David. Welcome, Minister.
Could this podium be any bigger? Thank you, Claudette. Appreciate that. And Doris, for your kind words. You know, I reflect back on how far we have come since I've last spoken to you and your organization. And I have to say, we've moved a lot of files forward. So thank you for your advocacy. Thank you for your work. Thank you for your partnership. You know, this truly does not work if we do not have partners who are willing to work with us and move forward a positive patient experience. So that is very important to me. And Claudette, for your leadership. Doris, it is important that we continue these conversations because we're not done. There are so many opportunities, whether it is in scope of practice, whether it is the potential to continue to expand primary care across Ontario. It's really important that we work on all of these pieces together to make sure that we remember and we are always working towards that patient-centered experience. So thank you for inviting me to have an opportunity to speak to you today and to celebrate registered nurses, nurse practitioners, and nursing students in Ontario. I want to thank again Doris and Claudette for your leadership and for the invitation to join you here for your 24th annual Queen's Park Day. Good on you. Congratulations. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our comprehensive Your Health plan, introduced 1 year ago, we are building a healthcare system that provides Ontarians with the right care in the right place by connecting patients to more convenient care options closer to home. To support this, our government has been taking bold action to support and grow our healthcare workforce now and for years to come. And we are starting to see those results. With our plan for the second year in a row, we have seen a record-breaking year of over 17,000 new nurses registered to work in Ontario, and another 30,000 nursing students currently studying at one of Ontario's colleges or universities. Since 2018, 80,000 nurses have been added to our healthcare system through programs like the Community Commitment Program for Nurses and the Learn and Stay Grant, which provides a financial incentive or tuition coverage to nurses, including nurse practitioners, in exchange for a period of service in an area of highest need. Our government is supporting the future nursing workforce while bringing care to communities that need it the most. Working together with 9 Ontario universities, we have added 121 nurse training positions to the primary care nurse practitioner program, bringing the total number of nurse practitioner training positions up to 321 at schools across the province. And I have to say, you know, I just came out of a meeting and we need to celebrate our success more here in Ontario. So nurse practitioners in Ontario, anybody know how many we have? 5,000. Across Canada? 7,000. That's not 40%. We are leading Canada in nurse practitioners, and we can continue to do that in so many areas. With this expansion, Ontario has more nurse practitioner seats available than ever before, ensuring more Ontarians can connect to high-quality care when and where they need it. Increasing access to nurse practitioner education is one more way our government is taking decisive action to ensure there is a pipeline of skilled healthcare workforce for future decades and generations to help ensure Ontarians can access convenient and connected care closer to home for years to come. Our government knows that nurses play a critical role in patients' healthcare journey. They work in primary care, long-term care, hospitals, public health units, and in many other community settings, providing a full range of healthcare services, including, of course, prescribing, ordering, and interpreting tests, and diagnosing and treating illnesses. In fact, I'm proud to say that just yesterday, as Doris mentioned, we recognized the very first RN in Ontario now authorized to prescribe medication since we announced scope of practice changes in November. Congratulations. And our government is proud that Ontario is one of the first in Canada to adopt the nurse practitioner-led clinic model, investing over $46 million each year to fund 25 nursing practitioner-led clinics across Ontario, connecting nearly 100,000 patients to the primary care they need. Ontario currently leads the country with 90% of people connected to a regular healthcare provider. But while we're pleased with this progress, we know that there is more that we can do. And I was thrilled to stand beside Doris and Claudette, your leadership, earlier this month to announce our government's record investment of $110 million to connect over 300,000 people to 78 new and expanded primary care teams, including nurse practitioner-led clinics and family health teams consisting of nurse practitioners and registered nurses. The Ministry of Health modeling shows that our initiative combined will help connect up to 98% of people in Ontario to primary care over the next several years. We've made a lot of steady progress over the past year, but we know there is more that we can do. Our government will continue to work hand in hand with healthcare partners like the RNAO to take bold action to provide Ontarians with the right care in the right place. Thank you again to our world-class nurses and all of you in attendance today for the incredible care you continue to provide patients and families in communities across Ontario. It is noticed, it is appreciated, and we want to be there hand in hand to work with you to make sure that we continue this incredibly important work. Thank you. Stay well.
Thank you, Minister. And we know that in the list you already mentioned one, which is great, is for more nurse practitioner-led clinics and such models, not only NP-led clinics, community health centers and others, and also for a stream of funding that nurse practitioners can work independently without user fees. We have this phenomena, and we know the minister has been in the media also disapproving of it, as is RNAO, of nurse practitioners opening shop and charging fees. We do not support that, and we do want for sure, though, for them to be able to serve patients. So that's the conundrum, and hopefully we can partner on that and move that forward. As also, hopefully, we can be the first province to have RN prescribing in the curriculum. And that's not a difficult one. We already have early adopters, colleges that want, and universities. The college is quite on site that it's possible to start with early adopters. Let's be the first and show the world what it can be. It would be, just so you know, it would be the first in the world. There is no baccalaureate, there is no RN prescribing in any baccalaureate program anywhere in the world. Let's be the first. We can sign it together. I can't wait for that. It's easy. It's easy. And it's an easy one, and it's a normal, natural one. Stand up, students. Students, don't take my food, please. I can see from here you're taking my food. It breaks my heart. Thank you for taking care of my food, yes. It's very important. Can I have students that are either in first or second year of nursing standing up? First or second year. Now, let's add third year. I am not going to say 4 because I don't think will happen this fast, but third year. Look, all these colleagues, because we are proposing that the RN prescribing, as is the course, be embedded in the schools in the 4th year. All of them could be the first ones, all their classes, the first graduating. Every year, Minister, and I know you know, but my colleagues may not know, every year we have 5,000 RNs graduating. Just picture what would happen in primary care, in home care, in anywhere care, quite frankly, long-term care, if those 5,000 nurse practitioners would have prescribing authority. Even if not all of them are embraced in their workplaces to do that, even if 60% of them, just picture what that will do to the system. Let's make it happen. It's really easy one to do. Questions for the, and you want that, right? Here you go. Here you go. Okay. Anyone? Yes. Yes, go for it to the mic. Go for it to the mic. There must be a mic. Here, you take this.
Hello? Okay. Hi, Minister. Thank you so much for being here. I do have a question about community. So we've talked about attrition. We talked about it earlier today. We were talking about nursing attrition in different sectors. What is your government doing to enhance opportunities to keep nurses in community settings and amplify them, building mentorship and giving them opportunities? Not just nurse practitioners, but also making sure that there's equitable compensation, because we've lost so many community nurses across this province to other care settings, and because of this, we're starting to see an influx in hallway medicine.
So when you say community medicine, do you mean particularly home and community care?
So not just home and community care and the agencies that they're working for, but making sure that we're building infrastructure for the nurses to stay in hospice care and other areas, because we always seem to forget about hospices.
Oh,
but
I don't.
That's because we're annoying.
No, that's because I see the value in hospice.
And those are areas too, right? When we think about the community settings and like safe injection sites, those community sites that we need to be advocating for to keep those nurses with those high skill sets and the mentorship to build the new nurses that are coming in and the retention.
Yeah, thanks for the question. And it's an important one because, you know, we talk about the success of 2 high historic years of nurses being registered in the province of Ontario. Many of those international graduates, but it also means there's a very high influx of brand new nurses and clinicians working. And so one of the programs that has been very successfully embraced is the Nurse Preceptor Program, which is basically matching that mid-career, more seasoned clinician with a new grad. And I can tell you from speaking to many in hospital settings and elsewhere that it has been very much embraced. Really appreciate the ability to integrate that very high skill set with a new eager grad who is not familiar with the system that they have in place. In terms of community care, you know, I've spoken to many pending grads, and one of the questions I always ask is, where are you going to practice? Where are you going to go? Because truly, the sky's the limit. You know, you can go to a public health unit, you can go to a hospital, you can go to human community care, you can go to palliative care. We've done some very serious expansions in palliative, increasing the number of beds and access, and most importantly, increasing the operating so that they can have stability in that system and they can have consistency. But to me, it is a system that we have to look at collectively. We cannot have a strong hospital system if we don't have a strong home and community care system. So I hope what you have seen is as we stabilize, for example, wages in the home care sector, we're making sure that we are not unduly influencing or impacting the long-term care sector or the hospital sector. It is very much a balance for us to work, particularly with me, with the Minister of Long-Term Care, Stan Cho, to make sure as we make changes on the hospital and the home care piece, we are not destabilizing other parts of it. And, you know, I guess it's because it's topical, but last month's announcement of primary care really was all about how do we make sure that the only place of access and point of access cannot be an emergency room. We have to build up the primary care expansion piece. And I've heard it over and over. People love working in multidisciplinary teams. Patients love being in multidisciplinary teams. You know, when Mrs. Jones gets diagnosed with diabetes, it's not the family physician who is going to walk through what that means to their lifestyle, their family, their what they need to do to manage that new illness. It is an RN, it is a dietitian, it is other people who are working in that same multidisciplinary team, which is why the focus for me with these expansions was very clearly how many unattached orphan patients can you build into your organization with this expansion, but also how can that multidisciplinary team be augmented better to support the patient. Thank you.
I have the privilege of being a hospital CEO in the Northeast and recently in the Northwest as well. And this is one of the most difficult times that I've seen in my years as a nurse, in terms of watching my nurses working hard, working understaffed, coming in, on double shifts and so forth. And at the same time, I feel hope because of the longer vision that you and your team have. So I do see a light at the end of the tunnel, and no, it's not a train. So thank you for that long vision. My heart sang as well when I heard about the investments in primary care, because I agree that that's very important. In the North, hospitals and smaller agencies are often the main source of primary care. And so I appreciate as well that you're looking at balancing the investments in hospitals and in primary care. Because in the North, our nurses are the ones that offer that whole gamut of care, and probably, more efficiently in some ways that they can. So I hope that you will consider looking at the North, and I'm curious about what the strategy is for the North, whether we will have something unique, something different, because we know it is a lot harder to recruit and retain. We know that there's evidence that support that if nurses come from the North, they're more likely to stay and practice in their communities as well. So would love to hear any plans that you may have or vision on that piece, please.
Yeah.
Thank you.
Thanks, Sue. And if you've worked on sort of both sides, East and West in Northern Ontario, you know that historically it has been a challenge. So some of the things that we've done, so of course the Northern Ontario School of Medicine, we know the stats show if you train in the North, you're far more likely to stay and continue to work in the North. The expansion of RN seats in all, frankly, colleges and universities, but particularly in the north. That expansion has happened, and that will take time. I understand. You don't train someone in 6 months. But those types of programs do make an impact. We, of course, have some very specific programs available for Northern Ontario hospitals. And again, there's more work to do. But I am incredibly proud of the Ministry of Health team and Ontario Health, because we have not had an emergency department closure north of the French River in over a year. And that's because people are now starting to work collaboratively. Do we need more? Absolutely. But that type of work really starts to have an impact. With the Learn and Stay program, and I think we talked about this the last time I was here, you know, that program started with only RNs. It's now been expanded to lab techs, and in Northern Ontario, it has been expanded to community paramedicine. So when we see where there are programs and policy opportunities, then we like to be able to think that we can react quickly to make those changes. And listen, I rely very heavily on the feedback of organizations and leadership to tell me where those opportunities are. When I came into the ministry, the nurse preceptor program was very new. Almost everyone I talked to, I asked, how is that program working? Because I want to make sure that as we make those investment and changes, it's actually impacting the front line in a positive way. So keep the feedback coming, because it is really important for us to make future decisions on where we need to make the investments. But you don't have the mic yet. This is I feel like the Speaker of the House.
There is a lineup.
Thank you very much,
Paul Andre,
Minister.
there is a lineup. Thank you. Thank you. I want to remind our colleagues, all, Sue in particular, and some may remember this, that, and I was telling this to the student also, that we do have the one-to-one tuition reimbursement, right? So get people there, and if they stay for a year, 1 year back, 2 years, 2 years back, 3 years, 3, 4, 4, the entire program then becomes paid by basically taxpayers' dollars. The same is for RPNs. So please, please, please spread the word, and that to me is an indication that we also from RNAO from time to time need to spread the word again. So that exists and is not always fully used. So that should help. Rob.
And that Learn and Stay program that Doris is referencing, huge interest and uptake. So be assured, you have lots more members who are going to be joining in the years to come, because they are very engaged in the Learn and Stay program.
Hi, Sylvia. My name's Rob, and I saw you this morning walking.
I was thinking that while I was freezing on University Avenue.
It wasn't that cold. Anyways, I'm the chair of the Ontario Nurses for the Environment, but as well, I work in community, and there is a $10 per hour on average pay gap between hospital and community in British Columbia. There is pay equity between the different sectors for unionized jobs. My question, this morning in question period, one of your colleagues mentioned how you guys were doing so well at increasing the firefighters for Northern Ontario, because in Northern Ontario there's a lot more fires. Now, in British Columbia, in Northwest Territories, they had to evacuate because of fires. And they had to evacuate a 100-bed hospital because of fires. ICU patients, diabetes patients, hemodialysis, everything. With climate change, we're having fires and other extreme events. These are putting a huge burden on our healthcare system. We have to be able to adapt so that we are able to surge. We need a low-carbon healthcare system. What are you doing to adapt our healthcare system to be low carbon, but also be able to surge when these large climate extreme weather events happen?
Okay, there's a lot to that.
And then pass the mic, no second question. I'm going to become like the people that manage the video.
Speaker of the House.
One question at a time, because there is a lineup and then there are other people coming, so that's it. After our colleague, that's it. No more after. Thank you.
So thank you. I feel like I need to take the Ministry of Health hat off for a minute and talk about my previous role in Solicitor General, which had care and control for Emergency Management Ontario. So there has been some very recent work out of Emergency Management Ontario specifically for municipalities to give them funding and investments so that they can do training and purchase equipment specifically for these highly unusual and impactful events that are happening in some of our communities. So that's going on at Emergency Management Ontario. The Premier Ford has often spoken about the 50 capital builds that are happening in our hospitals across Ontario right now, whether it's new, expanded, or renovated. And all of those projects would have and do have a component that talks about how can we manage our carbon footprint. So some of it is easier to do than others based on the type of, whether it's an expansion in downtown Toronto, a little more challenging with limitations on space. New builds, of course, have a different opportunity. There was a hospital recently opened, very small community hospital in Markdale, Ontario. Anyone know where Markdale is? Where it was a LEED building. So that work goes on as we renovate, build new. But it is, we have 140 hospital corps around the province. 50 are in some kind of capital expansion. So as those maintenance pieces happen, then that's where you get the opportunity to do more of the how do we manage our footprint to make sure that as one of the largest employers in many communities, a hospital isn't part of the problem, they are part of the solution.
Thank you. Thank you, Ruth. Deb.
Hi, Minister Jones. My name is Deb Lefebvre, and I sit on the Board of Directors representing Region 9. I live in Kingston. I wanted to thank you for providing funding to the Periwinkle team-based model of care. I'm a nurse practitioner in the program, and I'm looking forward to providing those skills at that center. RNAO is focused on EDI. We heard from tremendous panelists informing us about how we're going to move toward equity-deserving platforms. I know a Black woman who recently lost her baby due to racism in healthcare. We know that Black women are 4 times more vulnerable to losing either their lives or their babies during pregnancy. And we also know that many of those deaths are preventable. When I look at the data, it is only American-based. I understand through the media release that our provincial government, has received a substantial amount of funding from the federal government.
Oh, it's less than 1% of my budget, but keep going.
In that media release, though,
4 minutes for everybody before marriage style comes.
I'm just wrapping up. In that release, it's noted that a certain amount of that funding would be dedicated to data collection. Will you commit to collecting race-based data so that we know what is going on in our healthcare system with respect to racism and discrimination so that we can make improvements to eliminate systemic racism? Thank you.
Thank you for the question. So coming from Kingston, I have to share this story. So the Periwinkle is the expansion in the primary care, and Dr. Jane Philpott actually led that expression of interest. And I loved how she described it on the day we announced it. And that was, if you need to see a doctor, you're going to see a doctor. If you need to see a nurse practitioner, you're going to see a nurse practitioner, or an RN, or an RPN, whatever. Her point is that multidisciplinary approach allows that to happen. And also, specifically related to data. For 3 years, we have had Dr. Philpott leading a Ontario Health Data Council. And that really is collecting the data that we need from hospital community to make equity-based decisions. I just shared with the Data Council yesterday that we are going to be extending their work for an additional 3 years because we have seen the value already in what they are doing. Part of the expression of interest assessment that happened in the primary care expansion included an equity piece. So you will see a number of primary care expansions that were very specific to whether it was LGBTQ, whether it was, there's a First Nations brand new primary care that is happening. That's one of the expansions. So part of the assessment and the grading was based on the health equity and where do we need to do better, frankly, in making sure people access the care. Having said all that, we cannot have different people getting different access to care because of the color of the skin or their gender identity. And so there is a piece that will continue to be educating and ensuring that that cannot happen in the province of Ontario because it is absolutely unacceptable.
Hi, Minister Jones. Thank you for being here today. And I also just wanted to take the opportunity to thank you and your team for all of the investments that you've made in our profession. It's really appreciated. I have more of a comment than a question. I know that it's no surprise to any of us in this room that we're facing exceptional challenges with not only recruiting but retaining. Again, thank you for those investments. My comment is that in speaking with some of my colleagues, we feel that if the provincial government looked at alleviating income taxes, specifically provincial income taxes, for public nurses, those working in the public system, that this could potentially help alleviate some of the concerns that we're seeing, but also show your prioritization in our public system, and thank you so much.
So if this was question period, I would be turning to my seatmate, who is the Minister of Finance, and saying, over to you, Mr. Bethany-Plummer.
And I would be saying, I signed the check.
I will, thank you.
Hello, thank you for being here. My name is Geneviève Lucier. I work in Ottawa. I'm a registered nurse first assist, which is an extended role of a registered nurse. We are a funded position in Ontario from the government.
I'm just briefing the minister simply because it was an initiative that started before. So I want her to know that it's in operating rooms. And I also want to say...
It's like briefing on the fly.
Thank you for being again engaged. It was a very active group. We got many positions a few years ago and then it went dormant. You can assume why.
And this is why I want to ask.
But now it's needed.
Okay.
So we do the surgical assistant.
Yep.
So there's a surgeon and there's a nurse.
Yep.
We cost half of what it does for a doctor to assist to the system. I do mostly total joints. And my question is there a plan to get more funding for these positions that not only save money to the taxpayers, but we also give excellent care to the patient in the operating room, and as well retention, because nurses who come in through the operating room see that there's an extended role where we do a whole lot more responsibility, and we definitely make a difference on many levels, from residents to medical students to nurses students to patients to care.
Thank you.
Yeah.
This will be the last question. Sorry. Last. No, we have Mary's time.
Where'd you go?
No more. Just you and funding. We need funding for more registered nurse assist. And then the three that were in the lineup will be the first for Mary's time. Here you go.
So happy to take the specific piece back to see where that program is. I will say that we have a innovation fund, health innovation fund, that is available to community organizations, in community organizations as well as hospitals. And we are starting to make assessments now on which of those expressions, which of those applications could qualify for an innovative piece. And that would essentially be almost, think of it as a one-year pilot to assess and show that the model that they want to do is actually going to make a difference province-wide. So it allows us to, in a very small way, test an innovation and then scale it province-wide. So, yeah.
Thank you.
Was
we
it?
will bring
Yeah.
the minister. It's a file that we never have bring the minister.
Thank you.
Excellent, excellent. Thank you, Minister. It was terrific. Thank you for the questions. Apologies that you didn't all have the time. Minister, next year we need to book you for even more time, and we will get more. That's what we like to see. Wait a minute. Did you see that handshake? The minister with Mary Stiles? This is what we said in the morning. We work to get there if we want to move things. This is not your government, it's our government. When you will see it, whoever will see it, is our politicians. They work for the public, all of them, and we work with all of them together for the public to make things better. Thank you. My president, Dr. Claudette Holloway, will formally introduce Marit. Marit was with you guys at the breakfast a bit, and then I will introduce her informally.
Thank you, Doris.
Or we'll thank her informally, and you can...
We'll work it out. So a very warm welcome to Marit Stiles, Leader of the Opposition, of the official opposition, the Ontario New Democratic Party, MPP Davenport. Marit Stiles is the leader of the official opposition and the Ontario's New Democrats. She has been the MPP for Davenport since 2018. Prior to this, she represented the area as their public school trustee. Prior to becoming the leader, Marit has served as the official opposition education critic, partnering with education workers and parents to defend public education. Before entering elected office, Marit fought to strengthen Canada's arts sector and stood up for culture sector workers as the National Director of Research and Bargaining at ACTRA, Canada's Union for Broadcast Media Professionals. Born and raised in Newfoundland, I hope I said Newfoundland right, Marit moved to Ontario to study and find work. She lives in Toronto with her partner, Jordan, where they have raised 2 daughters. Welcome, Ms. Stiles.
It's understand Newfoundland. You got it now. I always say, understand Newfoundland, right? No, you did great. Thank you so much, everybody. It's great to see you all here. I'm welcoming up my colleague, Wayne Gates. He is MPP for Niagara, but also, more importantly, our critic for long-term care. And really, such an incredible advocate for long-term care. I wanted to make sure he had a moment to say a couple words too, and answer your questions. Listen, I want to start by thanking Dr. Holloway Lamo, who I just want to say I met a wonderful nurse practitioner and president-elect. We met in the fall at Humber River, and just so inspiring, and of course to Doris for everything. But look, I am just thrilled to be here with you today. I was thinking back, and I think that this time last year when I addressed this group, I think it was probably one of the first big events, meetings that I actually spoke to after I became officially the leader of the opposition and the leader of NDP in Ontario. And I felt, I was very nervous, actually. I don't know if you could tell, but I was a little nervous because, I really respect the work you do. I know that you were going to have tough questions, or hope you do again. And also, you know, I just, it's an issue that in terms of the things that I care about and where I see our priorities going forward for the next 2.5 years till the next election, and hopefully after we form government in 2026, is healthcare. It's healthcare. And you are at the front line, not just as the workers, but also as the advocates, as the visionaries, as the experts. And I really, you know, many years ago when I was much younger, I worked a little bit in health policy and had the benefit way back then of being able to rely on the excellent research and work that RNAO was doing, also under the leadership of Dr. Greenspoon. And I just want to thank you from the bottom of my heart for all that you have done up till now and all that you continue to do. Yeah, give yourselves a round of applause, please. I know you've had some exciting panels and conversations. Can I just get a show of hands? How many of you, is this your first Queen's Park Advocacy Day? Wow, that's impressive. Well, congratulations. Did you find yourself, were you able to find your way around Queen's Park? Yeah, mostly, right? Well, listen, I want to thank you for all that you've done. As you could probably saw this morning, I assume most of you were at question period. The entire NDP caucus, all 28 of us, are working very hard to address, I think, the myriad of issues that are facing our public health care system in particular. And with Wayne as our long-term care critic, with France Jelena as our amazing healthcare critic, and may I just say, she would be here today if she wasn't on a flight back to her riding of Nickel Belt because she injured herself in a snowboarding accident. And those of you who know France will not be surprised by this. But she injured herself, and she's got to go back and have it looked at. But otherwise, she would be here with us as well. And she was here this morning, and I'm sure you heard her question. She's fantastic. But look, the issues that are facing the public healthcare system in Ontario are costing the people of the province. Who don't know whether an ambulance is going to come in time, or whether an emergency room will be open when they turn up, or whether they're going to get to see a nurse or a nurse practitioner or a doctor or anyone without spending a whole day in a waiting room. And we see also, of course, you know, a lot of promises that are made over the years, but we're seeing, while those promises are being made, we're seeing clinics close. Just last week, I had a group of retirees and steelworkers from Sault Ste. Marie who founded a clinic in Sault Ste. Marie, who are now seeing that clinic losing doctors, losing nurses because of underfunding, because they cannot attract people. And at the end of the day, that's going to mean 10,000 people in Sault Ste. Marie are left without primary care by May. So, you know, and then today I raised it, maybe you heard me raise the situation in Perth. And this is what we're seeing over and over and over again. And as I think many of you here are more than aware, the latest stat I heard is by 2026, a quarter of Ontarians won't have access to primary care if we don't turn things around fast. As I'm traveling the province, and since we last met last year, I have been around this province a lot. I've met, I think, with many of you actually in communities across the province, talking and listening, not just to the problems, but to the solutions. And I think we are all aware, very aware, certainly in our caucus, of what you're facing. I really appreciated seeing the research here that RNAO has provided, but I didn't need it to know the stress, the anxiety, the moral distress that you are experiencing on the job and in your communities. And it is shameful, and we need to do something about it. Hospitals and long-term care are desperately understaffed, making Ontario's ratio of registered nurses per capita not one of the best in Canada, but one of the worst. And this simply cannot go on. Status quo, I like to say, is no longer an option in Ontario, and I'll talk about that a bit more in a minute. But I want you to know very clearly that Ontario's New Democrats are committed to pushing for solutions that will actually not just create a dent, but actually transform our healthcare system for the better. As I just said, all of us in the room know some of the solutions. You are the experts. And the evidence-based work, the data-driven work that you do, the extraordinary work of the BPG, the BP guidelines, like all of this expertise, this excellence that you promote is so, so important. What I find so very frustrating is that the solutions are right there before us. The government could start to fix this mess right now if they wanted to. But just increasing funding for our public hospitals alone, it would make a big difference. But the truth is that we need to see that expansion of community health centers, of nurse practitioner-led clinics. And you know, more importantly, what we need to do is stop the Ford conservatives from doing what they're doing right now, which is funneling millions of those public healthcare dollars into the private sector. You know, thank you. We've known all along, like, that was going to cost the system more, right? We've been saying it all along. But we have the evidence now that it's been in place for a little while from the Ontario Health Coalition, data that shows us that what this government's actions are actually costing us. And more importantly, they are hurting us. Premier Ford increased funding for for-profit corporate clinics, hospitals, etc., while at the same time imposing those wage cap bills, those cuts, leading our public healthcare system into deficits. And I'm going to tell you, and you know this, but as I travel around the province, and I've been raising the flag on this for, I don't know, at least the last 6 months, I am hearing more and more from especially small rural hospitals who are saying they don't think they can make payroll. Something is deeply wrong with the system when we are hemorrhaging our public health care dollars out like that and we are not getting the return we need. And I don't need to tell any of you this, but I thought I'd share some numbers anyways on how those government funding cuts are playing out in real time across the province. Between 2022 and 2023, over 2,000 people have died on waiting lists for surgeries. There's been a 22% increase in hallway health care. Surgical wait times are 49% longer, and 170 hospital beds and 60,000 more staff are going to be needed at least over the next 4 years. The nursing vacancy rate has more than doubled since the Conservatives were elected, and things weren't so rosy before then, can I just say. But these are not just numbers when I talk, and I know that you know that intimately, but I feel like sometimes when I'm talking to other groups and you name off the numbers of the people who have died, you know, it's like, those are just numbers. No, those are families. Those are families, those are real people with loved ones and jobs and contributions to make. Real people who have died because we have a government, I'm going to say it, that just refuses to unleash the money that we all know would go a long way to alleviating the immediate issues that are keeping our public hospitals in a chokehold. And I'm going to let Wayne talk a little bit more about long-term care, because I know we're also facing very much the same crisis. If we continue down this path, these numbers are going to get bigger, more lives will be lost, and we will create a society with people who get health care and those who do not. And those people will suffer. And I want to tell you, that is not the Ontario that I came to 30 years ago when I moved here from Newfoundland, and it is not the Ontario I want for my children or their children or their children. The NDP is the party of Tommy Douglas, right? So for us, I have to say, I think, like, we always feel like it's like our duty to protect this system. And to, you know, if you're the party that created free and public health care in Canada, you can darn well count on us to never back down on this issue. We will not stand by with a government that is hell-bent on starving the public health care system. We will not do it. Now, I want to recognize how hard you've been working. I did that at the start. And I want to also recognize the time you're giving up here today to be with us.
because, you know, in a past life, I did a lot of this as well. For different issues that I was working, I would come to Queen's Park or go to Parliament Hill and lobby and talk to people and hope they listened. And you're giving up time with your families. And I want to thank you because many of you are very active in your communities on these issues. I want to thank you as well for your contribution there. But look, there is a lot of work to be done, and I want to talk a little bit about the solutions as I see them. Obviously, we've been calling for increased funding for nurse practitioner clinics. You know, if COVID was an all hands on deck moment, surely this is too, right? We need nurses, we need nurse practitioners, we need internationally trained healthcare professionals who are ready to go and ready to work right now. There is so much, and I want to congratulate RNAO. I know you had a really interesting panel earlier, but I want to thank you for taking the time and making one of your focuses here today addressing equity and diversity and inclusivity in healthcare. Black, Indigenous, BIPOC people we know, to face systemic racism every single day. They face it out there navigating everyday life, and unfortunately that also means that nurses and healthcare staff also experience that racism, those structural barriers in our hospitals, in our long-term care facilities, in their places of work. And on the last day of Black History Month, I want to say let's all commit to putting in the hard work to address and end racism and all forms of discrimination in Ontario's healthcare system. Each and every single healthcare professional deserves to feel safe, supported, and respected. Yes. I also want to do a big shout out to my colleagues in British Columbia, because they just brought in nurse-patient staffing ratios. Yeah, and I am darn proud of that. I think we all are over in the NDP caucus. But you know, I think it's important to mention it, not just because they're New Democrats, but that is definitely part of it, but also because, look, you know, they're showing that there's other ways to do this, that it is possible. And when government officials sit down with you, and I'm sure, I suspect you may have heard this a few times today, and they say, well, we can only do so much, there's only so much money, there's only so much time. I would challenge that. We have done big things in the province of Ontario, and we can do big things again. And so I want to wrap this up for a moment by just saying a few things to you about my vision. Government after government, I think, have shortchanged us enough. They tell us that we have to settle for less than better. They want us to believe that the answer lies in privatization. And by the way, they may have created the chaos. We all know that's far from the truth. We know not only what needs to happen right now, but we are also going to work together with all of you to build a vision for the future of public health care. As I said at the beginning, I mean, clearly the status quo isn't good enough, but I really do want to challenge all of us to think about what a healthcare system that really works for Ontario, that works for everyone, actually looks like. You just saw Jagmeet Singh in Ottawa leverage his power in Parliament to push and actually, you know, move the needle forward to get us a public universal pharmacare program in this country. That is exciting. Universal dental care, making mental health part of our public healthcare system. You know, these seem like these are not pie in the sky ideas. And I will say, as Doris noted, when I came in and I shook hands with the Minister of Health, absolutely, we need to work together. And when you have these unique moments like we're seeing in Ottawa right now, where actually government has to work with other parties to get things done, like, yes, we can actually accomplish things that way if we work together. If we work together and come up with innovative and creative solutions to the problems that we're facing. We need to build this vision of the future of healthcare on the expertise of frontline healthcare workers, of RNAO, on data and on evidence. We need to not only rebuild what we're losing, we need to revolutionize it. And with that, I want to say again, thank you so much. You can probably hear what I'm saying is I'm tired of half measures. I want to build a vision so that in 2026, and I'll work real hard with Wayne and my colleagues, and we'll try our best to keep things moving forward and not backward. Well, I will say, I intend to have the government reverse course on one more big policy, and that's the privatization of healthcare in the next year and a half. But I'm tired of these, bad decisions and then rolling it back and changing everything every 4 years. I want to revolutionize our healthcare system, our public healthcare system in Ontario. I can only do it with you. And I want to thank you again for all the work you're doing. Thank you so much, and thank you for looking after the people of this province. Thanks.
Yes, he has to be introduced formally. He will be introduced formally. So thank you, Merit. You are on it. Thank you for your passion and thank you for your vision. And I thank you for saying that you're willing to work with organizations like RNAO. RNAO has a lot of solutions. We have a policy department. We have a CEO that has a vision. We have members that have a vision. So we look forward to going in the positive direction with you and any political party that's going to make a significant difference for nursing and healthcare. Before we go any further, I must thank Wayne for his patience. He was here for some time while the Minister of Health was here, and we want to give him his formal introduction. So Wayne Gates. Yes, okay. So Wayne Gates, long-term care, retirement home and home care critic, Ontario New Democratic Party, MPP for Niagara Falls. Wayne Gates is the member of Provincial Parliament for the riding of Niagara Falls, which includes Niagara Falls, Niagara-on-the-Lake, and Fort Erie. He has the unique distinction of being elected twice in less than 6 months, first by winning a by-election in February of 2014 and then again in the general election 4 months later. He currently serves as the critic for long-term care, retirement homes and home care. Prior to his election, Wayne served as a city councillor in the city of Niagara Falls. Before entering politics, Wayne proudly represented the membership of Unifor 199 as their local union president for over a decade. Wayne also served as the campaign chair for the United Way, member of the Yellow Shirt Brigade to save the Fort Erie Hospital, member of the city's Recreation Committee, Project Share volunteer, and member of the Ontario Health Coalition. Wayne and his wife Rita live in Niagara Falls, and they are the proud parents of 3 daughters and grandparents of 5 grandchildren. They all make their home in Niagara region. Thank you, Wayne.
Thanks very much. That Wayne Gates guy sounds like a pretty good guy. I don't know. That's just, if all that stuff is accurate. Well, I just want to say, because I was asked to do this with Doris, I want to be very clear, because I don't know all your classifications that are here today during this conference. I will be clear that I believe in nurse practitioners. I think we should have nurse practitioners right across the province of Ontario. What I don't agree with is that we have nurse practitioners that set up clinics and then charge people to use that particular clinic. Our nurse practitioners should be covered under a publicly funded, publicly delivered health care. That's the way it should be done. So I just wanted to say, Doris wanted me to mention that. I only got 2 minutes. I've never done a speech in my life in 2 minutes, so I'm going to go quick. Hopefully everybody in the back can hear me. But I'm going to tell you, we cannot talk about going forward unless we talk about our past. And I want to congratulate everybody here who stood up against Bill 124 that attacked women's in our workplace. Everything they've done, quite frankly, has been an attack against women, and no respect to the men that are here at all. But most of it, 70% of the people that work in this profession are women. When you take a look at, you go to the next step. They brought in Bill